Welcome back to the Sensitivity Doctor. Today, I am joined by Dr. Teela Tomassetti. I have been dying to have her on the podcast because she talks about something that is near and dear to my life experience and also probably many of yours. Because did you know that 45% of women who go through childbirth experience some form of birth trauma? That's right. That means almost 1 in every 2 women. This is a topic we don't talk about enough, and we do it today on the Sensitivity Doctor. If you want to know whether or not what you experienced was birth trauma, if you want to know how to support someone who has, please take a moment to settle in and open your mind and listen to what she has to say about healing, identifying, and getting through birth trauma in a way that we all deserve. So I hope you enjoy the episode, and please feel free to reach out if this is something you've experienced, or maybe some of the things that we talked about were things you had never thought about before, but you're realizing, wow, I've gone through this. We're here for you. Enjoy the episode. I'm honestly so grateful that you agreed to sit down with me because I personally have a lot I wanted to explore with you. I've gone through a birth trauma myself.
Oh, okay.
And so seeing how you have focused on something that I think is so important, but really not talked about enough, really made me want to reach out to you. And I know we had like a little circus trying to get our schedules together. So
That's what happens when you're both busy women. It's like, good luck.
yes,
Yeah.
agreed. I could not
But we
agree
did
more.
it. We did it.
Absolutely. So, yeah. So, can you tell me a little bit about your practice now and the clients that you work
Yeah.
with, and what have led you to the topic we're going to talk about today of birth trauma? Because, like I said, it's something that hits very close to my heart, and I can't wait to unpack it with you.
Yeah. So, how I actually got started in this is how I feel like so many of us do, which is through our own personal experience. So, but I always like to back it up just a little bit to share with people how I first came to hear about birth trauma was through one of my best friend's experience of it. And at the time, I wasn't a mother myself, and she was one of the first people to have a baby. And when I went to go see her, she just didn't seem like herself at all. And me being a therapist for so many years, I clued into that and was like, what's going on? Like, what happened? And so she broke down and said, actually, no one's even asked me about my birth story. And this is what happened to
Wow.
me. And, I said, this sounds like traumatic. And she said, yeah, you know what? I think a lot of women go through it and never talk about it. And so,
Agreed.
oddly enough, is that when I started my doctorate, I reached out to her and I said, you know what, Christine, I think that when I get to the project end of things, I think I'm going to do it on birth trauma. It always landed with me. And her daughter now is, oh my goodness, I don't even know how old Lucy is. I think she's 8 or 10. So it was so long ago, but it really stayed with me. And so I'd always decided that birth trauma was going to be what I did my doctoral research on. And then fast forward to 4.5 years ago, I would end up with my own. And so during the childbirth of my own experience, I suffered midwifery violence, which I was actually in the reporting process
Oh my
for 3
gosh.
years around. Yeah, it took 3 years for them to make a decision around what took place with me. And the medical end of things was that I ended up with a postpartum hemorrhage ×2. So an excessive hemorrhage during childbirth that resulted in significant blood loss and needing blood transfusions. A week in the hospital, it was what's called a near miss. And
Oh my gosh.
it was pretty wild times. And then 6
Yeah.
weeks later, I hemorrhaged again due to a retained placenta, and then needed to be hospitalized again for a DNC. And yeah,
Sorry,
and then
my face when you said retained placenta, isn't that part of the process of birthing is to birth the placenta?
yeah, no, of course, the placenta comes up, but it's a retained placenta. And so what that
Oh,
means is that there was a piece of it. And it's amazing how
gotcha.
even just a tiny piece of a placenta can actually wreak havoc on your system because it
Yeah.
convinces it that it's still pregnant. And so I
Oh my
had no
God.
idea that you could actually hemorrhage again up to 12 weeks postpartum. And
Whoa.
so many
Yeah, I didn't know
people
that
tell me on
either.
that. No clue. So when I was hemorrhaging at that point, I was at home holding Livy in my arms and stood up and felt this gush and was like, what is happening? And
Yeah.
just big baseball sized clots. And then reached out to my doctor and she was just like, you need to get to a hospital right now. You're hemorrhaging again. I'm like, I gave birth 6 weeks ago. How is this possible? So yeah, that's a bit about my journey and how it led me to this place of specializing in birth trauma the last 4.5 years. And so I completed my doctoral research in that area. I'm still doing research in the area, and it's my main area of focus. Yeah.
Which is how
Mm-hmm.
you landed here today. Thank
Yes.
you. There's something that you said that really stood out to me, and it was about, well, so many things, but that your friend had not shared her birth story and hadn't even realized that it had happened. And it makes me think of how I even find sometimes, like, let's say I interact with someone who's pregnant,
Mm-hmm.
and I always feel like I want to be cautious as someone who has experienced birth trauma, not to scare them about their journey, but also need support. I mean, I've done a lot of processing, and I'll talk a little bit about what I experienced as well. But I've talked a lot about it. But
Mm-hmm.
I always find that such a complex dance. Like, how do we get the support we need? Talk about it, name it, and maybe that would be good too for us to
Mm-hmm.
define if you're a mother listening and you're thinking, have I experienced birth trauma? So how would you define the difference, and maybe there isn't a difference, between the stresses of birth and birth trauma?
Mm-hmm. Yeah, so I like to say that birth trauma is anything that exceeds our nervous system's ability to cope before, during, and after childbirth, because I think we have this really big misconception that it must only take place during childbirth. And that's not the case. I think of like immediately what comes to mind is like HG, hyperemesis. Which is like a condition that a lot of women have during their pregnancy, which some will say is like extreme morning sickness. And for those who have had it, find that
Right.
insulting because it's
Yeah.
actually very traumatic. And the state that they exist within during their pregnancy is something that no one should ever have to deal with. So that's an example of it actually taking place before childbirth. And then obviously during childbirth is a slew of different causes that can take place anywhere from emergency situations to NICU stays to provider mistreatment, things of that nature. But then there's stuff that actually happens afterwards where, say, like the actual childbirth went okay, but it was the moments or minutes or hours afterwards that left a really big impact. And so I just want to start with that definition to help people to understand that it can happen just like at any stage of the game. And now, what is key to remember when we're defining this is that the individual is the one who gets to define that experience. And so,
Yes.
trauma is a very subjective experience. And what that means is that, like, we're not choosing to be traumatized, but our nervous system made that decision for us. And so, what might be, traumatic to me, you might look at and be like, oh, like that wouldn't bother me at all. Like, I would actually be okay moving through that situation, and vice versa. And, I've been in lots of spaces with people where they've told me things that I would have labeled as traumatic. And they're like, no, I was good. Like, I had a really good support system around me. How people handled it. And also, like, my partner was really there for me made such a world of a difference. And so I think that for people trying to decide if this was their experience, first of all, only you get to define that. And sometimes we get stuck in those check boxes as well of just like this idea of like, oh, I don't meet the diagnosis of post-traumatic stress disorder through the DSM-5, so that must not be my experience. And it's like, well, no, trauma is so much bigger than those check boxes.
Right. A
Yeah.
lot of what you're saying, I think relates to my experience. So I had, gosh, how do I even, I'm trying to like package this. And it's funny when you try to talk about it, it's almost hard to organize it. I gave birth to almost 10 days overdue to a baby, my daughter, with a 98th percentile head. And I am 5'1" and I have a small frame. And my body was doing this wild thing from the very jump for when I first started laboring at home called coupling, which you maybe have or have not heard of, where basically your contractions don't stop. You don't get any relief from them. And because they don't stop, they don't have enough time to your body doesn't have enough time to relax to ramp them up effective enough to do what they're meant to do. if that makes sense. So someone might think, oh, if you're having coupling, then the baby would just come sooner, when in fact it's that your body doesn't actually gear up strong enough to contract hard enough to get the baby out.
Mm-hmm.
And so my labor from the very beginning started off with me coming into the hospital, telling the nurses that, I think it was a nurse because that's such a blur, that I was in excruciating pain. And then her, honestly, I felt discredited from the beginning. Her kind of looking at me and going, "You're barely 2 centimeters. You need to go home." And I'm just like, why do I feel like I'm already being torn in half? And mind you, I had this plan of having like an all natural birth, like, nothing. I was one of those like, I'm gonna, tap into my animal energies and do this thing. And so they sent me home, and I couldn't even sit, I couldn't stand, I couldn't move, and so we went back, and then they tried to send me home again, and I said, no, you have to let me stay. Like I'm in so much pain, and they wouldn't take me serious. And we started to progress through the labor like you would expect a non-medicated birth to go. And as it continued at hour 20, this was only halfway through my
Mm-hmm.
labor at this point. I buckled and said, I need something. Like I need to do like what was it called? I'm like escaping the epidural.
Yes. Yeah.
It's crazy because people have probably heard me talk on here before, and I usually sound like I know what I'm talking about. But as I start to talk about it, I can
Your brain
feel
shuts
my,
down.
yeah,
Yeah.
I can almost feel my own nervous system start to shut down a little.
Uh-huh.
So at that point, they gave me an epidural and it didn't work. Like my right leg went numb and that was it. And I kept expressing, and my husband was trying to back me up. I kept expressing that I wasn't getting any relief and nothing was working. Everything they were doing was so painful, like the big balls and the this and the that and like all these things. And I just felt so discredited the entire time. By hour 40,
Mm-hmm.
40. So I went through 40 hours, nearly 40 hours, not eating, not drinking other than chips. I started seeing things in the room. I started talking to people that weren't there. I was getting totally delusional. I remember the moment that the 8 a.m. shift started. Suddenly, they recommended a C-section. Like,
Oh, wow.
finally, this far into it. And I remember being so out of my own body that I didn't even realize that was something I should ask for, even though, like, my daughter was in distress. There were and it's like when you hear it, it's like, why do they let me go on that long? And I really, when I think back, I really don't understand it. And I remember when I went in to get the C-section, they had to put Ativan in my arms because I was convulsing. It was terrible. And after my daughter was born, God, I might get emotional talking about this. After my daughter was born, I passed out. Like I was totally asleep. I couldn't, I just like my body just was done. And for anyone watching, I'm definitely teary eyed right now. But when I was when after, and I had her, and we're spending time in the hospital. I'm a very extroverted person. Like I love people around and all of this. I remember I wanted no noise. I wanted no
Mhm.
music. I wanted the sound machine on the whole time. Little little word to the wise, bring a white noise machine to the hospital because you hear so many things in the middle of the night that it's a number one. I loved it. But I barely remember people coming and going. It was so crazy. I think it took me a whole month to like feel that
Yeah.
connection. And I know for a fact how different this was because when I had my son, it was during the beginning of COVID lockdown. There was trauma in the world, but it was a planned C-section because there was no way I was going to go through that again, especially when my son was being projected at 10 and a half pounds.
Yeah.
Girlfriend, no. Um, I went in and like my doctor listened to me the whole way. Like he actually gave me sleeping medication for the night before, which is not always customary, but he listened to me. I came in rested. I had had my pasta dinner. I was fully awake. I was aware. I remember them taking him out and my doctor going, "It's a toddler," because he was so huge. And it was so wild. With her, I was in the hospital for 6 days. With him, especially because of COVID, I was like in and out.
Oh,
I was like,
yeah.
I'm walking to the end of that hallway if it's the last thing I do. For any of you
Yeah.
C-section mamas, you know how hard that is. It was just wild, the contrast
Mm,
between the two. And
absolutely.
so, like, I'm, it was such a personal thing for me to have you come here today, and why I was so happy that you're bringing attention to something so important.
Oh, Amelia, I really appreciate you sharing all of this. And, like, because I watched you, for your listener is like I'm sitting here, and especially as a trauma therapist, I'm watching you go through the motions. Like, and I'm watching different trauma responses appear too as you start to reconnect to a part of yourself. So I just want to thank you for doing that, because it takes a lot to go to that place. And if I'm being totally honest on my end, I disconnect when I tell my story. I'm at that place where, like, and it ebbs and flows for me, but I almost list it like a grocery list at this point, because I'm so
Yeah.
used to having to touch on it. But like, if you were to slow me down, like we just allowed you the space to do there and really connect with parts of it. Like, yeah, the emotion is there. It's tough. And even as I hear your story, Amelia, I hear like where the story, like where the trauma began. Like, and tell me if I'm wrong,
Really.
but I can hear it the moment you walked into that space and were ignored and
Yeah,
dismissed, right? Like that was boom.
absolutely.
That was trauma point number one, where it's just like, imagine what that would have looked like if
Yeah.
immediately when you walked in, they said, "Oh, it looks like you're in distress. Like, what can we do to help?" Or, "Let's really check you out here. What do you need?" Or
Yeah.
like got
Oh,
more
that would have been
curious.
so
Oh,
different.
it would have been so different. Like
So different.
everything after that would have looked so different for your experience. And I get very passionate about this end of things in the line of work that I do, because to me, that part of your story is preventable. Okay, so I like to talk to
Yeah.
people, because one of the things that I do outside of being a founder of the Reproductive and Perinatal Trauma Center and the research that I do is that I'm constantly trying to support people in understanding trauma-informed care across Canada. And like a large part of that is the things that we're speaking to, which is really the bare minimum, just meeting people where they're at,
Right.
offering that note of compassion. It can make a difference between somebody feeling traumatized and somebody
Mhm.
feeling like, whoo, that was really hard and difficult, but I made it
Yeah.
through and I'm okay, and
Yeah.
baby's okay, and everyone here in this situation is all right. But like, yeah, so I just deeply appreciate you sharing that story. I really do. Hmm.
I love that validation that you just provided for me, because I don't know if I've ever really pinpointed that moment, because I can see her face. Like, I can see her face in that exam room and how little she took me serious. And I remember telling them something feels wrong. Like, I don't know why I'm not getting any relief, because you watch the movies and you see like, oh, whew, that's over, like the different
Hmm.
contractions. And I remember it was days into it when they finally like did this special monitor to double check something. And this one nurse coming in and like grabbing the feed, that comes out of the contraction machine or whatever, and going, "Oh yeah, yeah, looks like you're having coupling." And I'm like, "What's that?" Like, I had no idea. Um, so yeah, you're right. And I think this actually leads really beautifully into something I wanted to ask you about when it comes to sensitivity, because I believe, because I am a highly sensitive person and my nervous system is as sensitive as it is, I was probably feeling this even more intensely, which impacts my body's ability to relax, to do what it needed to do. And I'm curious if you have worked with any highly sensitive nervous systems or neurodiverse individuals, and like how this kind of thing impacts them and what they can be doing. Because I don't feel like enough medical providers are educated on the difference of like helping a highly sensitive nervous system go through birth.
Yeah. Yeah. No, I'm so glad we're talking about it. And I felt a little embarrassed over the summer, because so Birth Trauma Awareness Week is in July, and um, they finally kind of highlighted that this year. I don't know if you noticed that, but they actually talked about neurodivergent folks and like the impact that birth trauma might have on them. And I was a little embarrassed because I thought to myself, this is the first time I'm doing a post on this. So like I'm a little late in that sense. And then, I stopped to think about all my colleagues in the field and they haven't been making posts on it either. And yet, in my therapy space every day, at least once a day, I'm coming across a parent who is. And so when I kind of set out to make that post, I really did a deep dive into the research, the very limited research around this, but also like why it would be such a different experience for somebody coming from that kind of mental state. And so for me, like when I think about it, I think about the sensory overload and the processing differences that somebody who is like an ADHD parent, we'll just go with that, or, someone on the spectrum with autism or Asperger's, but it's just like their sensory overload is going to feel really different. So yes, we're all getting overloaded when we're going through a traumatic symptom, but when you're already walking in, feeling some of that energy, then like a birthing center or a hospital is going to feel like a bit of a nightmare. Like if we break down like the bright lights, okay, let's just start there. Those lights are horrific. The fluorescent lights in general, nobody benefits from that. But then you put in someone who has, neurodivergent tendencies, then that's just a nightmare for them. And so they're already starting off in a place where their environment doesn't feel safe for their nervous system. And then I think about the invasive procedures and how like when I have my highly sensitive clients, like the thought of like being touched by somebody that they don't know, or like when consent is such a critical aspect here. It's such a key factor to, again, preventing some of that preventable birth trauma in folks, is like if we're really slowing down and going over those pieces for a highly sensitive person, that's going to feel like the validation that we were speaking to earlier. And that sense of safety is really going to exist. But when it's not there, when somebody's just poking at you and prodding and doing these things without your permission, a highly sensitive person is going to feel like hijacked in that moment. Yes. And so those are just some of the things. Yeah. And so also with somebody on the spectrum, like you're going to also, like the body holds it more acutely, which is also what you were starting to bring up at the beginning is like, and then I think of, sorry, my brain goes in so many different directions.
That's great. I'm here for it.
Come along for the ride with me. But it's also like the neurodivergent brain is also going to struggle with the sequencing of events, which is also what already takes a hit when you have trauma. So like even when you were starting to explain it, do you see how you're going into the freeze trauma response?
Yes.
Your brain was already wanting to shut down. That's our prefrontal cortex.
I felt that.
Right? Yeah. And so like I watched you go, like the light start to leave your eyes where your brain was like, I don't want to go here. I'm going to shut down. Again, when we're in these situations that are chaotic, that don't feel safe, a highly sensitive person is already walking and feeling like that. And then you throw these other pieces at them that are already traumatic, and it just snowballs for them. And then to me, one of the things that I see so often in my space with highly sensitive people is that the diagnosis of birth trauma gets completely missed or dismissed. And so it gets it gets chalked up to them just being sensitive, right? It's just like, oh, it's just a part of your experience as a person with ADHD or autism. And it's just like, no, that's not the case here. Yes, that is what was taking place for them as they walked in, but it was everything within their environment and their nervous system that was making that situation even worse. And so like, I think that they get missed. And that they are dismissing themselves, and then society is really quick to do that too.
Yeah, and I think about like the kind of the hopes and the expectations after as well. Like I was saying how it took me, and it's so wild because I told you that my birth with my son, even though it was a C-section, even though it was literally the second week of the COVID lockdown. So I remember getting there and no one had masks on. And by the time I left, I mean, like the regulations were literally changing at lightning speed when I was in the hospital. My response when my son was born, it was like I knew him the second he was born. Wow. And I feel that way about my daughter as well. And I did, but it took me almost a month. And I remember it wasn't until my friend came over she was about 3.5 weeks old, and he made her laugh for the first time, and it was like something pierced through my nervous system to be like, oh wait, she's like a whole baby. You know what I mean? Like it kind of like, and not to say I wasn't like not bonding with her and things like that, but and I say this to anyone who has had this experience and I feel like I had postpartum trauma, absolutely, because my husband was going to go back to work at the 2-week mark, and I was like destroyed at the thought of him going back. I was like, you can't, like, I'm not ready for you to go back yet. And luckily we were in the position to be able to make that happen. And I wish we were in a country that could just as a whole make that happen. And I'm so grateful for that. But as a highly sensitive person, like my level of empathy, and as HSPs in general, like our level of knowing and empathy is so high. There was this total like dissonance where I'm just like, I'm supposed to be so enraptured by my baby, but yet I think she's adorable. I was appreciating her, but there was just something missing.
Yeah, that
And
makes
that
sense.
was really hard. And it makes me wonder if I missed, this was another term that I had seen you talk about that I think we have all kind of heard in different ways, of the golden hour. And I wonder if I missed something with that because of what had happened and how I was feeling after. I was wondering if you could explain what the golden hour is and what can happen if that gets missed. And how
Yes.
to deal with it if it gets missed.
Absolutely. Okay, so I want to preface
Yes.
when we're talking about this, it's so important to understand that this is not black or white, because
Right.
I think we need to back way up when we talk about this to talk about the misconceptions around the golden
That.
hour, to
I love
even
that.
just start right there. Okay.
I love
Because
myths. Let's obliterate
yes.
them.
Okay. Well, it's one of my favorite things to do personally, because I think there's just so much pressure and intensity that are placed onto mothers right out of the gates around all of this, around pregnancy, around childbirth, and like how this is supposed to look in postpartum. And the golden hour to me is very dangerous in that sense, because what it does is that it tells people that there's this really significant, critical time that exists between a mother and a baby, or a parent and a baby. It's always important to me to be very inclusive when I'm talking. And so what happens is that the golden hour is this beautiful time that if you're able to get it, and so I want to start off saying that if you're able to get it, it's right after birth. And so some people will say it's like the first 15 minutes, you'll watch that. And that if you're able to get this beautiful glowing amount of time with your baby, then you won't struggle with the bonding. And then it's like an instant bond between you and baby, and off you go riding into the sunset with each other. And yeah, I'm being
No
totally
sleepless nights. No,
nothing. And I'm being
everything's perfect.
facetious on purpose, because it
Yeah.
actually
It
drives
is a
me
little
nuts.
ridiculous.
Yeah, it's, you know what? The narrative needs to stop. It does. Like, is it great if this happens? Absolutely. But I really want to stress to you moms and parents out there that you do not need it in order to successfully bond with your baby. And that, yes, birth trauma is going to interfere with pieces or aspects of the bond, but it will come. But I also think we need to normalize out of the gate, Amelia, that like bonding takes time.
Right.
It takes
Especially for
time
highly
and
sensitive
effort.
people, because sometimes
Yeah.
it takes us time to adjust to a whole new role and a whole new, because even, getting a new home or a new job or getting married, those are traumas to your nervous system too. They're just the little T's. They're the little micro traumas that just disrupt, and especially if you have a sensitive nervous system, can take time to adjust to.
Yeah, so please, like right out of the gates, just like give yourself grace. Like you just went through something traumatic and it really rocked your nervous system, and you're not going to be 100% of a person anymore in that moment, never mind 100% as a parent. And so I think we need to take that pressure and expectation off of ourselves, whether there's birth trauma or not. Okay.
I love
But
that.
then when there's birth trauma, it's just like, again, really coming from that compassionate place with yourself around not only might this take a little bit longer because there was so much that we were up against together, but also like it takes, like, read the actual research on this. Okay. Is that like, if we look at child development, it takes a year. So it's usually around the 1 year mark is when a child can actually securely attach to somebody. But
Okay.
again, we have this idea that it's
Right.
immediate, that the
Right.
second baby comes out, is this immediate secure attachment. And it's like, no, baby kind of looks at you as like a bit of a vessel where we're there to feed them, to change them, those pieces. But that attachment takes time and takes energy. And so if you didn't get it right away, it doesn't mean that your relationship with your baby is never going to happen or it's always going to be
Right.
strained. And I think that if we start with that place in those conversations, you'll watch the bond actually happen even quicker because women don't feel this intense pressure to like get it done and have it happen. So yeah, I
Right.
just want to normalize like not having love at first sight. And
Yeah.
yeah, that these things just take time and that's
Right.
okay. Hmm.
hmm I love that because it, first of all, like you said, gets rid of whoever originally came up with this. There's probably some sort of chemical
Yeah, no,
experience
there is.
happening, and there's a
Mhm.
reason for this term and this idea. But I also want to champion for anyone here who is a C-section mama, having been one unplanned and then planned. There are ways to initiate this bond early
Mhm.
on that I would love for anyone listening to know that you have as an opportunity if you want. So because I was able to plan it for the second time, I did opt, people are going to think this might be crazy. I did opt for the clear cloth so I could kind of see what was happening. I didn't really
Yeah.
look. It was just kind of like I wanted to see them, lifting him out. And then I also opted for him to be placed on me while they were stitching me. So those are things you're allowed to do that I don't think people know you can do with
Absolutely.
C-sections. So I
Yeah.
think that's really helpful, but it's also okay not to because like I said, I passed out the second my daughter was born. I remember my husband being like, "Do you want me to stay with you or go with her?" And he's like, and I was like, go with her." And then I was
Mhm.
out.
Yeah.
Um, and then, but you will, they will be there. Like they will be there after.
Yes.
And I love that. I love the idea of like giving yourself like the golden year, not the golden hour. Like give yourself that whole time, if not longer, if you need. And it
Yeah.
makes me think for for anyone listening who maybe is postpartum right now, which we know postpartum is not just the first couple months.
No.
I want to ask you actually, what time frame do you define postpartum? Because I think it's obviously much longer than we
Yeah.
give credit.
Okay, well, with or without trauma, because
Oh, okay. Good
yeah.
question. I like how
So
you volleyed yourself your own question. Go for it.
I think that postpartum to me is at least a year. That's at
Okay.
least a year. The first
hmm
year for sure, if not longer. And then I think when there's trauma involved, I would tack on another year to that, because I
Definitely.
think that the nervous system is shot, and I think that there's a lot of shock and denial at the beginning too with birth trauma, that people sometimes don't even identify that they have symptoms of it until months later, sometimes the first year anniversary, right? The
Right.
birthday is usually what triggers a lot of people, and they are able to recognize like, oh, I am not well about this day, like something is going on
Yeah.
for me. And so, no, I get so concerned about this idea of how we view the fourth trimester, especially medically. And that, really after the first 6 weeks, I think the medical system is like, okay, you're good now. Like you made it, especially like when I think about cesarean mamas and that, where it's just like after 6 weeks, you're good to go. There you go. Like you're off and running. And it's just like,
Right.
this is not the story that I'm hearing from people.
No.
And so I just wish that we would hold mothers differently, and that for at least that first year, let them go through the motions of getting to know themselves in such a different way. Like their identity has
Right.
completely changed overnight. And I think that's part of postpartum is like discovering like, who am I now? Like, and
Right.
that kiddo's always changing. Like every other day, that baby is changing, and so are we. And
Right.
so I think we're quick as a society to really recognize the changes that a baby has, but it's just like, what about what mom is going through and all those changes too?
Right. And
Mhm.
when I think about too, I have read research, two other kind of arms to this about the postpartum period is that on a hormonal level, it can take up to 2 years for the body to go back to its pre pregnancy nutritional reserves and hormonal levels. So just being mindful of that. And then on top of that, we want to remember that the amygdala grows after giving birth. And it's not, this massive growth, but it is a marginal growth. And it has to do with what helps us be vigilant and protective. And there are studies that also show if you're listening and you're not the biological parent, anyone who is highly participating in the rearing can also have some growth in their amygdala. And this is where our fear center lives. And so if we consider the fact that we were talking also about highly sensitive people already have a much more active limbic system. And if you then include that, I can imagine for a highly sensitive nervous system, it may, like to your point, take over a year or more.
Oh, yeah. Yeah. I think a year is the bare minimum. And I know which one you're talking about with the 2 years because I've done a post on that as well. And it's real. Like this is science. This isn't, a TikTok trend or just something that we're making up to give moms a break. Like this is literally science. And, going to that amygdala is like that thing doesn't turn off because of trauma. And
Right.
so again, if you're already walking into it, already activated, and then you suffer from trauma, that hypervigilance that you're going to see afterwards is that amygdala not standing down, not recognizing that you're safe now. And I think that sense of safety is how we make it out of trauma. And that takes a lot of time and a lot of
Right.
courage from ourselves, but also from our community around us.
It makes me think of, I have a client who had experienced some birth trauma and she was at I'd say 18-month mark after. And everything as far as like the home and all of that, I feel like she was kind of like finding her footing and we were processing it. But what I discovered was that she had joined this car seat safety group on Facebook and was almost obsessively checking it and looking into it and getting more information. And I had asked her one day, is your car seat secure? Do you know how to use it? And she's like, yes. And I kind of brought to light to her that I think in a way you might not realize that you're kind of perpetuating and reinforcing the checking behaviors that can happen when we have experienced trauma to give us this notion of safety and control. I challenged her to unjoin the group and see what happens and see how that feels. And so I'm saying this to anyone listening who has experienced birth trauma. There might be patterns in your life where you have created a sense of control around something and it may or may not be needed. And the help and support of a therapist or a professional or someone that you trust it can feel scary to let go of some of those things, but it can also be really powerful and helpful.
Yeah. Yeah, that sense of control is just trying to create a sense of safety for you. And there's other ways to get it. And at first, that can be almost impossible to see. And so if you're even struggling with like trying to acknowledge that or admit that, that's so normal. It's so normal. You're just trying to create a sense of safety.
Yeah.
Yeah.
So I have one last little, question or kind of area to close up our conversation today, because what we've been doing and what you gave me the opportunity to do today was a little bit of birth debriefing, which we really haven't named specifically what that is. You can kind of deduce what it is, but the importance of it and where to get it and how it's not something you just do right after birth. And I want to know from you if you can help folks understand if they're listening and they're thinking, well, yeah, I experienced a trauma this many years ago, or I just experienced a trauma. How do they get a birth debriefing? What is the difference between a birth debriefing and maybe just, kind of processing with someone? And then also kind of a side question to that, how can people who haven't experienced trauma in birth help their loved ones or people that they're supporting who have? Because I do think there's a little bit of a mismatch, because some women are just like, well, that was the best day of my life. I felt like a superhero. And I'm amazed. And I think it's amazing that those stories exist too. So,
Yeah. Well, and we're only encouraged to tell those stories. right?
Yeah.
Like,
Like I was saying, I felt bad sharing my birth story with a pregnant
yeah,
friend because I
yeah,
didn't want to scare her.
yeah.
But maybe there's room for us understanding just because your friend experienced something scary, it doesn't mean that's going to be your story.
Yes, yes. And I think it's a fine line sometimes that we do kind of teeter on when we're sharing our story. But I think it starts with like acknowledging that your story, a traumatic story deserves to take up as much as space as like that fairy tale ending that we get to see on movies and TV shows. Is that like our stories are just as valid. And when we think about the percentage and when we think about how up to 45% of people describe their births as traumatic, that's a
It's a
significant amount of
lot.
stories it is so much. And it's really accurate.
It's
It
like almost
really
every other
is.
birth.
Yes, yes.
I think I
And
looked up there's like 300,000 births a day in the world, something around that number. So about 150,000 women just went through a traumatic birth today.
yeah,
That's
but
wild.
will we hear about it?
No,
Will they be
probably not.
given the space to talk about it? No, because like people get really uncomfortable with that. And that's where you often see the toxic positivity that we offer ourselves or that the people around us do. Like, well, at least the baby's healthy, that kind of energy, or you'll forget about it in no time, like, or it could have been worse, or like those aspects. And it's because we get so uncomfortable sitting with these difficult feelings when like birth is supposed to be this magical place, and you know what, for it's not for a lot of people. And I think that that's okay. We need to normalize that this is actually really difficult, and for some traumatic. And so a birth debriefing, to kind of circle back to your question, is it can be done in a variety of different ways. So with myself as a therapist, that's one way to do a birth debriefing, which is like where like, and I used to offer that all the time for folks, where it's just like, if you just need someone like a safe person to talk to about your experience, and don't want to do years of therapy, you can always do that. But then there's also medical birth debriefing, which is like what I've been unpacking with the hospitals here in Canada, is how do we get better at addressing some of the questions that people have? Because a lot of it is like the why did this happen, or like how did it unfold this way, and those questions really perpetuate and help the trauma symptoms to grow. And if you can address those in a really compassionate, warm, and empathetic way, it's like it's amazing, honestly, Amelia, the stories that I've heard from people where they get those birth debriefings from medical staff and how it resolves so much in a snap.
Oh, I bet.
Yeah, and it's just like it's so powerful when someone says like, "Oh, this is from a medical standpoint, this is why we were doing it this way." And not in a defensive or
I
explanatory.
never got that. Did you
Yeah,
get that?
no. Oh, goodness, no. Like,
Yeah,
no, and it would have made such a difference because like even to this
agreed.
day, I'm still wondering why that first hemorrhage happened, but it was like a perfect storm. I had been laboring for too long, the midwifery violence, the unconsented cervical checks, like all this stuff that was taking place. But it's just like to have those answers really does make a difference. So I want people to think about birth debriefing not just as the sole responsibility of yourself, like as the survivor to talk about and share your story, but also like those around you need to be taking better steps, whether it's, the OB that you were working with in the medical team, or like your family and friends saying like, no, but like, how was your birth story? And like, if that feels comfortable to share with me, like, I can hold that for you. Like, I'm okay to hear, all the details if that's what you want to share, or just pieces of it. So I think just like that's where it starts, is actually with our village around us, like making spaces where it feels safe enough to actually go there. And then you got to pick the right people. To do
Yeah.
it. Because I've also heard the opposite, whether it's family and friends or medical providers who have like exacerbated those trauma symptoms and made it that much worse because of how they handled a person's story. And
Right.
so, like, pick the right people to do this with. And if you're unsure, reach out to accounts like mine, and I'll try and point you in the right direction of where that can take place. But it's so powerful and it's so healing. But within that, to me, like how we actually heal through birth trauma, my opinion around that is through each other. It's through connection, it's through sharing, and like being able to like hear our story within somebody else's, even if they're so different. Like that's how we move through this. But we have to start with society saying like, oh, this is okay to actually even talk about. Like
Right.
that's back it right up to that place. And then healing can happen.
I love that so much because I can see so many layers to why that would help us and anyone who's on the journey to become pregnant, because when you look at how trauma is held in the body, there's no way to argue that having a birth trauma would not impact or could not possibly impact future ability to get pregnant, future ability to have a successful, healthy, or less traumatizing birth again. Like if you're holding all of that, your body keeps a score, right, everyone? Like it's going to carry some of that. And so I can see how the debriefing is not only helpful for you now and the baby you have now and the body you have now, but if you are someone who wants to continue on this journey, I think there's a notion when you think about why we're not talking about this, that if you don't talk about it, have you ever heard you just forget it? Like,
Yeah,
oh
that's
yeah,
not
you just
true.
forget the pain. I'm sorry, but no, you can dissociate from it.
Yes.
You can
Yes.
deny it. You can
Yeah.
be spiritedly delusional about it, but to actually forget it. Although I will admit, not having experienced the Ring of Fire, I have heard there's some sort of like out of body thing that happens there. You do forget some of that, but like we need to obliterate the idea that you just forget it, I think.
Oh,
And
absolutely.
right, right.
Yeah.
And instead have it be that it's okay to talk about it, because I can imagine down the road, my highly sensitive daughter is probably going to ask me, am I going to have a birth like that? And I'll be able to tell her, well, first of all, she's going to be way taller than me, so she'll probably be fine. But um, she's already my height almost. But being able to say, to your point, this was my experience, but this is very unlikely won't be yours, but I can hold your nervousness about it. I can allow you to process your nerves about it because you're allowing me to process what happened for me. I'm not saying I would do this with my daughter, but just kind of in general, us
Mhm.
having this dialogue back and forth. I love that you're championing for that
Yeah. Well, and we
so much.
can't, and circling back to the debrief too is like, um, we also need to kind of revamp when we do that because like if we think about the 6-week checkup, that's usually like if the birth is unpacked, that's usually when it's taking place. And a lot of survivors would argue that's almost too early. That yes,
Oh,
please check in
absolutely.
with me. But like again, if I think about trauma and what it does to you and how you're in a state of shock and overwhelm, like that 6-week checkup is a bit of a joke on a lot of different levels, in my opinion. But also like we need to do it 3 months and then at 6 months and then a year.
Yeah,
Like we
kind of
need
like
to
how
be
you check up on
constantly
the
assessing.
baby.
Yeah, let's constantly assess for trauma symptoms because also it often gets misdiagnosed as postpartum depression. The research shows that.
You're right.
And what's missing is that they're not even asking about the birth. They're just seeing some symptoms
Oh,
that
good
look
point.
similar to PPD, and they're going, okay, well,
Yes.
this must be what you have. Ask the question of how is the birth? And not only like,
Yes.
oh, you're not sleeping, this must be the baby. Why aren't you sleeping? What
Yes.
is taking place? That's such a key question because then
Yes.
someone's going to unpack it and say, like, oh, well, every time I close my eyes, I get flashes of the birth, right? Or when I try to fall asleep, I have nightmares. Okay, this is not PPD anymore. Or this is not
Right.
just a tired mom dealing with a newborn. This is something
Right.
so different. And so, like, yeah, birth debriefing just also to me connects to that 6-week checkup and just how we're failing parents. We really are on a lot of levels.
Such an important point. And if they don't offer it in a medical space, finding someone like yourself, because I also wonder how much they're allowed to explain when I think about, the legal implications with the medicine. And I mean, I don't know if we were going to compare American medicine to Canadian medicine, but it just makes me wonder if there's a little bit of for those places where they're not offering this and they should be. I'd be very curious about that. But boy, do I wish they did. I am so happy that I got to have you come on the podcast today,
Thank you
Teela,
for having me.
honestly. On a personal level, I appreciate you. On a macro level, I just really hope someone who has either gone through this, knows someone who's gone through it. Like, please share this episode with someone that you love, who has gone through a tough birth or who is nervous about birth coming up. But you had mentioned that people could reach out to you to get advice on places to look or where they could look for debriefings or maybe even just some of your work. So please, if you could, let people know where they can find you and what kind of things you put out into the world that they can have access to.
Yeah. So I guess the most accessible way to find me is on Instagram, which is where you found me.
I can attest to that.
So the handle is the T, so like the tea that we drink, the T on birth trauma. You can also find me on my practices Instagram too, which is perinatal trauma practice. That's Instagram. You can find me on Facebook too for the Reproductive and Perinatal Trauma Center. So that is what I founded here in Alberta. And so we support people with birth trauma, pregnancy loss, fertility struggles, and then the reproductive end of things like endometriosis, PCOS, IUD trauma.
Oh, awesome.
Yeah, often. And so if you even just Google the Reproductive and Perinatal Trauma Center, you'll find our website there and you can email me. I do the email thing, but my name is so long.
Yeah.
I'm really slow. So just find me on those avenues. My virtual door is always open. I'm usually really accessible for my followers. Every day I'm getting flooded with stories of people just wanting to share or connect or asking for resources. Just know that I'll do my best. I may not always have the perfect answer, but I genuinely care about those reaching out, wanting to connect over their experiences because I know how lonely this can be. And that's why I created that Instagram. Yeah.
That is so wonderful. And I would highly encourage everyone here to reach out and just keep connecting on this and talking about it. So thank you again so much, Teela, for coming on. And I hope everyone here takes some time to get your needs met, take a break, take a breather, and be well, everyone.